my name's Trina and I work alongside Dr. Osterhout in our functional medicine department and head up our medical weight loss team. My health journey started when I was 8 years old and diagnosed with migraines. By the time I was 12, I had developed ulcers from the amount of NSAIDs that I was taking, and also developed multiple food sensitivities and eczema, but in the 70s, these things weren't addressed. Thankfully, I also grew up going to regular visits with our family chiropractor. But in my late teens and early 20s, my symptoms started worsening until I developed mild aphasia and seizures. And that's when they found a mass on my brainstem. I was 24 when I had my first craniotomy. It was an intensive surgery to biopsy and hopefully remove the mass. And when the doctors realized it was benign, the decision was made to do a fenestration to keep cerebral spinal fluid from building up and putting even more pressure on my brain. I recovered from this surgery quicker than anticipated, and for the first time, I really had no major symptoms. My migraines went away, I had no seizures, and even my speech was better. Until 2 weeks after I had gone home from that surgery, I had a massive cerebral hemorrhage at the surgical site. I instantly had debilitating head pain and continuous vomiting, and I was taken to a local hospital. They were in contact with my other surgical team from a big university hospital a ways away, and after a week with no real improvements, a spinal tap showed that my cerebrospinal fluid pressure was off the charts. And I was put in the ICU and told I had to be transferred back to that big university hospital again because there was nothing they could do to help me. Until 2 weeks after I had gone home from that surgery, I had a massive cerebral hemorrhage at the surgical site. I instantly had debilitating head pain and continuous vomiting, and I was taken to a local hospital. They were in contact with my other surgical team from a big university hospital a ways away, and after a week with no real improvements, a spinal tap showed that my cerebrospinal fluid pressure was off the charts. And I was put in the ICU and told I had to be transferred back to that big university hospital again because there was nothing they could do to help me. And that was a pretty scary situation. I spent that night thinking about my 10-month-old baby at home that I was desperate to get back to. I was transferred back to the other hospital and underwent a series of daily spinal taps to drain the blood from my brain. And that left me with even more time to think about my treatments, my family, and know that 100% this path was not one that I wanted to take forever. After a slow recovery, I finally got back to my result of being mostly symptom-free. My surgeons were still insistent that I have another surgery to place a shunt from my brainstem to my stomach, even though I was not having any symptoms at the time. The risk of that surgery would have come with a lifetime of side effects. Thank goodness my family advocated me, and with my surgeons okay, I was able to delay treatment for a year. I returned to work more dedicated to health than I ever have. I've been in the field of chiropractic and functional medicine for 30 years. I took supplements, received regular adjustments and acupuncture, and was able to live a mostly symptoms-free life. At my 1-year checkup, I told the doctor I wanted to wait for 5 more years, and although he assured me my symptom relief was only temporary due to them deciding not to plate my skull, he agreed, and I decided I was done with that route. Even though I was better, I still had underlying inflammation in my body, and I developed a couple of autoimmune disorders due to that. It wasn't until I met Dr. O that I had heard of environmental medicine. Being a member of the American Academy of Environmental Medicine, he had access to research, therapies, and treatments that were available at very few offices in the States. It's equivalent to functional medicine on steroids. He assured me this was the missing piece, but by retraining my immune responses to environmental exposures, like food sensitivities and pathogens and environmental exposures, I could truly reach a level of healing I hadn't known before. 30 years after that initial surgery, my health continues to improve due to Vitality's integrated approach. It really is the missing piece. I am passionate about the care, hope, and support we give our patients every day, and very grateful to Dr. O for the opportunity to be a part of this team that I love so much, and for giving me and my family a better quality of life.